This video does not replace the instructions for use, which provide important information describing how to use your Repatha Pushtronex System on-body infuser with prefilled cartridge. Prior to using your Repatha Pushtronex System, it's important that you review the instructions for use in full. Call your doctor or 1-844-REPATHA if you have any questions. Okay, let's get started. Let's review the steps needed to take your monthly dose of Repatha: preparing the materials, getting the device ready, doing the injection, and finishing up. It's important to store Repatha the right way. That means keeping it refrigerated in its original box. Don't freeze or shake it. Don't store in extreme heat or cold. To prepare for administration, take the carton containing Repatha out of the refrigerator. Once removed from the refrigerator, Repatha can be kept in the original box at room temperature for up to 30 days. Keep it in the carton until you are ready to use. Check the carton for damage and the expiration date on the back. If it is damaged or the date has passed, use a new on-body infuser and prefilled cartridge. If the package is intact and unexpired, let it come to room temperature for at least 45 minutes before injection. You could take it out of the refrigerator the night before and take Repatha the next morning. Do not try to warm Pushtronex using hot water or a microwave, and keep it out of direct sunlight. After at least 45 minutes and Repatha has come to room temperature, open the carton and review the instructions for use. Then peel away the white paper cover. Next, remove the plastic cover from the clear tray. Leave the on-body infuser and prefilled cartridge in the clear tray until you are ready to inject. Do not press down on the lid, as it might close the door permanently. Be careful not to touch the start button until the on-body infuser is securely attached and you are ready to inject. Gather all materials needed for your injection. Place them all on a clean, well-lit work surface with the clear tray containing the on-body infuser and prefilled cartridge. Next, you should wash your hands well with soap and water. Choose a skin surface that is firm and flat, like the outside of your upper arm, your stomach area away from your navel, or your thigh. If you choose the upper arm, someone else will need to help you. Select a place that is less likely to have body hair. You can trim the hair if needed, where you will adhere Repatha Pushtronex to your skin. Be careful not to inject into areas where the skin is tender, bruised, red, or hard. Avoid injecting into areas with wrinkles, skin folds, scars, stretch marks, moles, and excessive hair. Clean the site with an alcohol wipe and let it dry. Don't touch this area again before you're ready to apply the on-body infuser. You can now get Repatha Pushtronex ready by swinging the cartridge door to the right to open it. Be careful not to close the cartridge door or hit the blue start button. If you accidentally close the cartridge door, press on the left side of the door to release the door latch. Inspect and clean the bottom of the dosing cartridge. The medicine in the cartridge should be clear and colorless to slightly yellow. It should not be used if it is cloudy or discolored or contains flakes or particles. If any part of the cartridge appears cracked, broken, has pieces missing, or is not securely attached, use a new Repatha Pushtronex. Hold the cartridge with one hand and clean the bottom using an alcohol wipe. Do not remove or rotate the cartridge top or bottom. Do not touch the bottom of the cartridge after cleaning. Do not insert the cartridge more than 5 minutes before injection. When you've finished cleaning, load the cartridge bottom first into the on-body infuser. Firmly push the cartridge straight down until it's secure in the device. Once the cartridge is secure, close the door by swinging it to the left and squeeze firmly until it snaps into place. It's important to now move to the next step without delay. Make sure that you give your injection within 5 minutes after loading the cartridge so you don't dry out the medicine. It's now time to attach Repatha Pushtronex for the injection. Turn Repatha Pushtronex over and remove both green pull tabs. This will expose the adhesive and turn the loaded Pushtronex on. You will hear beeping and see a flashing blue status light that lets you know it's ready to place on your skin. Here's some important information to take note of once you've removed the green pull tabs and adhesive backing. Avoid touching the skin adhesive with your fingers. Do not touch the start button until you have placed the loaded Pushtronex on-body infusor on your skin. Do not touch the needle cover area. If the red status light flashes continuously, do not place the loaded Pushtronex on-body infusor on your body. Choose your Repatha Pushtronex injection site. For this video, we have chosen the stomach. Place Repatha Pushtronex on your stomach. Stretch the skin to make sure it lays flat on your body so that the adhesive is completely attached. Secure the adhesive around the edges using your finger. Once it's placed onto your skin, do not reposition the loaded Pushtronex. You will see a blue light. Now you're ready to begin your injection of Repatha. Firmly press and release the start button. The flashing green light and a click is your signal that the injection has started. You may hear a pumping sound. You may also feel a pinch. The process takes about 5 minutes. When the device beeps several times and the status light turns from blinking to solid green, you'll know it's done. Check to see that the medicine window is free of Repatha and the used plunger completely fills the medicine window. When finished, grab the edge of the adhesive to carefully peel the on-body infusor off your skin. The used Repatha Pushtronex will also beep when removed from your skin. Don't worry if you see a few drops of fluid on your skin after you remove the used Repatha Pushtronex. This is perfectly normal. Always put the entire used Repatha Pushtronex into a puncture-resistant container right after you finish. Do not remove the used cartridge from the on-body infusor. You never want to put the used Repatha Pushtronex into the trash or recycling bin. Please refer to the instructions for use for full disposal information. Once you've properly disposed of your on-body infusor, check your injection site. If you have a little bleeding, press a cotton ball or gauze pad on the injection site. Just be careful not to rub it. You can put a bandage on it if needed. And that's it. You're all done. If the loaded Pushtronex status light continuously flashes red and you hear beeps, stop using the loaded Pushtronex. If Repatha Pushtronex is attached to your body, carefully remove it. Call 1-844-REPATHA, 1-844-737-2842.
What is Repatha? Repatha is an injectable prescription medicine used in adults with cardiovascular disease to reduce the risk of heart attack, stroke, and certain types of heart surgery. Along with diet alone, or together with other cholesterol-lowering medicines in adults with high blood cholesterol levels called primary hyperlipidemia, including a type of high cholesterol called heterozygous familial hypercholesterolemia, HeFH, to reduce low-density lipoprotein, LDL, or bad cholesterol. Do not use Repatha if you are allergic to evolocumab or to any of the ingredients in Repatha. Before you start using Repatha, tell your healthcare provider about all your medical conditions, including if you are allergic to rubber or latex, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. The needle covers on the single-dose prefilled syringes and the inside of the needle caps on the single-dose prefilled SureClick auto-injectors contain dry natural rubber. The single-dose Pushtronex System, on-body infusor with prefilled cartridge, is not made with natural rubber latex. Tell your healthcare provider or pharmacist about any prescription and over-the-counter medicines, vitamins, or herbal supplements you take. What are the possible side effects of Repatha? Repatha can cause serious side effects, including serious allergic reactions. Stop taking Repatha and call your healthcare provider or seek emergency help right away if you have any of these symptoms: trouble breathing or swallowing, raised bumps, hives, rash or itching, swelling of the face, lips, tongue, throat, or arms. The most common side effects of Repatha include runny nose, sore throat, symptoms of the common cold, flu or flu-like symptoms, back pain, high blood sugar levels, diabetes, and redness, pain, or bruising at the injection site. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Repatha. Ask your healthcare provider or pharmacist for more information. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information.
Remember, before using Repatha Pushtronex, and if you have any questions about injecting, read the instructions for use. You can also contact your doctor, nurse, pharmacist, or call the nurses at Repatha Ready at 1-844-REPATHA